I want to continue with this PowerPoint on principles of delegation. Again, differentiating delegation from assignment. Delegation transfers responsibility and authority. With assignment, there is no transfer of authority, reflects job descriptions and patient needs and the organizational needs. Now, when you look at delegation, why it is sometimes very difficult for nurses to delegate in the proper way, they always worry about the possibility of dumping. So you want to look at delegation versus dumping. We want to think of delegation as a positive thing in the healthcare environment, because the delegate really does use people in the best way to provide the best care. And it is the best use of time in a situation that can be a very busy area. It's not an undesirable task. It does serve as the greatest benefit to the patient, and it provides delegates with the opportunity for growth and increasing their skills. Now, these are the benefits of delegation. There's a benefit to the nurse. More time for complex patient care, because as the nurse, she, within her scope of practice, can only do certain things. It benefits to the delegate, and allows delegates to gain new skills and abilities, and it does bring trust and support. When you delegate correctly, it tells the person that you're delegating to, I trust you with this, I respect you, and I value you, and I support you, and I know that you can come through and do this the way I expect you to do it. And there's a benefit to the manager. More time for tasks that cannot be delegated. It benefits the actual organization, prevents a lot of overtime, and that's a lot of things that the hospitals out there are trying to get away with. A lot of overtime because people have to stay and do things that they couldn't get done in their normal shift, especially charting, certain skills or procedures that need to be done for the patient that maybe the RN couldn't get to. That's why delegation is so important. Absences decreased because people want to come to work because they feel that they have a fair share of work to do and they have good people to work with that can help in the care of the patient. And of course, productivity increases, and that's a huge, huge plus in regards to delegation. These are the 5 rights of delegation. You need to know these inside and out like you know your name. Right task, right circumstance, right person, right direction and communication, and right supervision. So that's really ends the PowerPoint. What I'm going to do is show you the delegation video from Pearson to kind of reinforce the information regarding delegation.
This lecture discusses the many considerations that are part of the delegation process. The American Nurses Association defines delegation as the transfer of responsibility for the performance of an activity from one person to another, while retaining the accountability for the outcome. Delegation can free nurses to focus on more complex patient care needs. It also develops skills of assistive personnel and helps contain costs for healthcare organizations. According to the National Council of State Boards of Nursing, UAP, also referred to as NAP or Nursing Assistive Personnel, are any unlicensed personnel, regardless of title, to whom nursing tasks are delegated. UAP have many job titles. Some of the more common ones are nurses' aides, certified nursing assistants, and patient care technicians. The delegating nurse must know the job description and match the skill level of the UAP to the task being delegated. Training and experience are both important factors in deciding which UAP can safely perform a task. Practice acts and regulations about delegating vary by state. The licensed nurse is ultimately responsible for the nursing care that is delegated. The UAP who receives the delegated task may not delegate it to another person. Delegation decision-making is part of the planning phase of the nursing process. Client protection is the fundamental principle when making the decision to delegate. Delegation includes all of the following elements: evidence-based practice, creating a scientific basis for nursing decisions. Boards of nursing, which write guidelines for delegation decisions. State practice acts that create regulations. Licensed nurses who are accountable for the nursing care provided. Policy making and procedures related to delegating. Ensuring that standards of care are met when delegated tasks are performed. Utilizing UAP, who help nurses provide complete nursing care to the client. UAP assist nurses. They do not replace them. The 5 rights of delegation address crucial elements in decision-making about delegation. Delegation increases the scope of liability for licensed nurses. Nurses are not directly liable for acts of negligence by UAP. However, if they are directly supervising a delegated act, when the UAP commits a negligent act, they may also be held liable. The first delegation right is the right task. When deciding which tasks can be delegated, nurses generally include tasks that occur often in daily care, tasks with predictable results and minimal risk, tasks with an unchanging procedure, tasks that do not require nursing knowledge and professional judgment, or complex application of the nursing process. Only nursing interventions can be delegated. Examples of appropriate tasks for delegation are taking vital signs, helping clients with transfers and ambulation, bathing, feeding, and bed making. Tasks that cannot be delegated are essential functions of nursing, such as interpreting data and creating care plans. Skilled nursing tasks, like administering parenteral medications, also should not be delegated. The right circumstances for delegation require nurses to assess the client's health status, analyze the data, and identify specific goals and nursing needs. The nurse must be aware of resources, matching the complexity of the activity with UAP competency and the level of supervision available. Delegation is based on the client's needs and goals at the present time. When the client's condition changes, the nurse must reevaluate nursing care needs and adjust the tasks that are delegated. The right person aspect of delegating means that nurses must be sure UAP are competent and understand the task related to the particular client. Nurses must be sure that they themselves understand and maintain professional standards. Nurses must evaluate UAP performance and take steps to remedy failure to meet accepted standards. Even if a task can legally be delegated, the nurse must still determine if the task can be delegated to a specific UAP caring for a specific client. Right directions or communication can be oral or written. They include stating specific data to be collected, the method of collection, and timelines for reporting. Providing directions and clear expectations of how the activities are to be performed. Naming the expected results or potential complications, including a timeline for reporting back about them. Right supervision means that delegating nurses must monitor and evaluate the performance of specific nursing activities or assign supervision to another licensed nurse. To supervise directly, the nurse might monitor the UAP's performance, obtain and provide feedback, intervene if necessary, and ensure proper documentation. The delegator may also supervise the delegation process indirectly by evaluating the client after the activity has been performed. There are some common delegation errors. Underdelegation may stem from lack of trust in UAP. It may also occur when nurses think they should be able to do the whole job by themselves. Overdelegation is a second common delegation error. Some managers overdelegate because they are insecure about their own ability to perform a task. Others do not take time to organize work efficiently. In either case, overdelegation increases stress and can decrease productivity among staff. Improper delegation includes delegating tasks at the wrong time, to the wrong person, or for the wrong reason. It includes delegating tasks and responsibilities that are beyond the ability or scope of the person to whom they are being assigned. Several tools are available to guide the nurse through decision-making about delegation. Decision grids and decision trees can be found in a variety of nursing textbooks or on the ANA or National Council of State Boards of Nursing websites. Supervisors or mentors can also be a source of guidance and direction when considering decisions about delegation. Delegation of tasks to UAP is essential to ensure that all necessary nursing care of clients takes place. If appropriate guidelines are followed, delegation to UAP can be a reasonable, safe, and resource-efficient method of extending nursing care. Delegation empowers UAP, builds trust and efficiency, and strengthens healthcare teams.
I hope you found that helpful in kind of summarizing the important points in regards to delegation. And one thing I wanted to definitely stress with delegation is we as nurses do not delegate to family members or friends of our patients, okay? That is not people that we delegate to. Again, think about the benefits of delegation. The nurse can devote more time to jobs that she only can do within her scope of practice. And really, there's so much benefit to the person that you're delegating to. You're not asking them to do anything that they shouldn't be doing. It really does help that delegate gain new skills. It offers them a sense of trust and support and really working well with the RN that particular person is working with. It does help increase their self-esteem and their confidence, and it provides great job satisfaction. Oh my goodness, I can do these skills. My RN trusts me. I love that. And it also motivates them to learn even more skills and to be a really competent and valuable part of the team. Their morale improves, and they really feel valued and very, very much appreciated. Benefits the manager. I mean, let's face it, a manager who has people that are really, really working well together, who are satisfied with their jobs. I mean, you're going to really provide great patient care when you have this kind of a teamwork going on. And the management then can devote more time to managing her unit than to having to work out some of the difficulties that may happen when people do not delegate in the correct way. And I think the bottom line is when you have good delegation working amongst a group of people, it really does increase the quality and improve the quality of care. And then you're going to have patients come back and say, hey, this was a great floor to be on. Teams worked well together. Nurses worked well with their co-workers. And you're going to have patients much more satisfied. Again, delegation process is define the task, decide on the delegate, who you're going to delegate that to, describe the task, reach an agreement, and to monitor their performance and provide them feedback. There's a lot of factors that do affect the delegation process. Assignment patterns, what kind of a unit that you're delegating on, pairing, who's the most effective means of delegating to, partnering, what's the really best assignment for that individual person. And when someone does accept the task involved with delegation, do they understand what they're exactly to do? Some of the obstacles we see in delegation is a very non-supportive environment, or there are a lack of resources, or even not enough staff. And of course, time resources. Some of the things that nurses do face when they delegate is, they're afraid that, oh my gosh, I'll look like I can't handle what's going on with my patients. So there is a sense of delegation insecurity. They fear competition. They fear of liability. They fear of loss of control. Well, if I can't do it all and I'm, delegating this task to another person, then I don't have really good control of what my patients are doing. Fear of overburdening others, and fear of decreasing someone's personal satisfaction with their job. So these are things that you want to think about, because I said it does take time to become a good delegator and to create a sense of peace and harmonious working environment. So it does take time. And what I'm going to show you now is just a little scenario of a situation of how all the 5 steps of delegation were not instituted in this patient situation. So let me bring this little scenario up for you to view. Okay?
That need my attention right now. I need to assess 3 of them. I need to talk to 2 of them about their upcoming surgery, and they don't want to talk to anyone else. I need to put an IV in one, and I need to talk about discharge plans with another. Can you help me out?
Sure.
Patient in room 23, Bob Smith. He needs penicillin intravenously.
Okay.
I'm going to delegate you this task. Is that okay?
Yeah.
Here's his chart.
Good afternoon, Mr. Smith. How are you doing today? I'm Alessia, licensed practitioner nurse. Good. I'm going to give you IV. Your doctor prescribed it. Is it fine with you? Okay? Okay. Is it okay for you? Okay. I'm going to check you in a couple minutes. How are you, Mr. Smith? Mr. Smith? Mr. Smith? Call me close.
On April 28th, 2011, I pronounced Mr. Bob Smith to be deceased at 12:30 in the afternoon. Hello, I'm Dr. Gomez. I am the doctor on duty. I was actually just brought up to speed with the incident that happened in room 23 with Mr. Smith dying from an allergic reaction to penicillin. I understand that you were the nurse in charge, and you delegated the duty to administer medication to Mr. Smith to the LPN named Alessia, correct?
That's correct.
As you might be aware, we might be facing a malpractice lawsuit, so we need to have the story straight. Before we get started, I want to ask you, are you aware of the 5 rights of delegation?
I am. The right task, it was. This was the right circumstance. I delegated to the right person. I had the right direction, and I had proper communication.
Okay, well that's good that you had the right direction and proper communication, but unfortunately you are missing a very important key, which is supervision. Your responsibility was to actually go back to the patient, evaluate the patient, and see signs and symptoms, and perhaps you would have caught the fact that he was having an allergic reaction, and this whole thing could have been prevented. Hi, Alessia. I am Dr. Gomez. I understand you are the LPN in charge of providing the penicillin to the patient. Okay. I just want to ask you a few questions. How often did you actually check blood pressure readings on the patient, and did you also check the intake and outtake fluids of the patient?
You know, doctor, everything happened so fast, and the patient went to shock right away. I didn't have time to do anything. He just died right away. I checked him a couple minutes, and went to the ER.
Okay.
Sedated.
All right. Okay, well, I understand it's a very stressful situation for you and the nurse, and I just want you to know that, the hospital's backing you up on this. Unfortunately, things like this happen every day, so I just want you to know that, it's going to be okay in the end, okay?
Alessia, what's going to happen to me? This patient dying is all my fault. I should have been supervising. I should have watched. Oh, I don't know what to do. What's going to happen to me?
And we're going to get on with that. We mail it to you.
We in hospital, patients die.
Yes, and there's
Nobody could ever think what
I know, I think we're going to the high risk environment where we should between the
I hope you enjoyed that video. It was a presentation by some student nurses who just tried to demonstrate the importance of making sure that all 5 rights of delegation are present when delegating that task. And unfortunately, you could see what would be a very horrendous outcome when any one of those 5 rights are omitted from the proper way to delegate. She did everything right, but she didn't supervise, and unfortunately, being that it was the first time that maybe this patient got that antibiotic, she maybe didn't give good enough instructions to the LPN in administering that medication. Maybe should have said, you know, he's never had this before. Make sure you check allergies, but stay with the patient for the first few minutes and make sure that he tolerates the medication well. Who knows? But she didn't go back and supervise. So that was where the error was, and unfortunately, look what happened to the patient. So, again, go over these 5 rights, understand, you know, what constitutes someone really demonstrating good delegation skills. And up here I have on the screen is Appendix 5 from your syllabus. And just to kind of go over about the delegation process, as you can see, what is in the scope of practice when it comes to RNs, specialty care, severe cases, sterile procedures, assessment, teaching, evaluation, IV meds. What would be in the scope of practice if you had an LPN work under you, chronic cases, stable patients, and routine procedures, and UAPs about routine procedures and activities of daily living. So again, we have a case study here where you're working on the night shift on a medical unit and have been assigned to charge nurse responsibilities, and you are working with 4 RNs, 1 LPN, and 2 UAPs, and a patient becomes pulseless and is not breathing, and the nurse assigned to the patient's care calls a code. So the nurse is occupied at the patient's bedside for about 1.5 hours until the resuscitation effort is completed, and the patient is transferred to the intensive care unit. So the nurse also has 4 other assigned patients, in addition to the nurse assigned to the care for the patient requiring resuscitation. 2 of the other nurses working on your unit are assisting in the care. So you've got a very, very serious situation going on here, and you really need some manpower to get the other patients cared for. So you've got these UAPs that are not going to be active participants in the code unless maybe they're doing CPR, but they're not going to help facilitate the code to determine what should be done for the patient. So maybe they're with some other patients, kind of making sure everybody else is okay. So what tasks could you delegate to the UAPs? So these are questions I want you to think about. So as the charge nurse, you can delegate to the UPS tasks that do not require nursing knowledge, as what we've been stated consistently through the videos and through discussing about delegation. For example, they can go and maybe take vital signs on all the patients to make sure everybody had their vital signs taken. And another thing is they can just go from room to room and make sure everybody's safe, because patients do recognize when sometimes there's an emergency on the unit, like a code, and you know, they're very stressed because they're also a patient, and you might want to kind of help these patients relax a little bit and not be so stressed to know that maybe somebody in the unit might be dying because of the code situation. So you just want to make sure that everyone's safe and everyone's doing okay, and that they've all have their basic physiological needs met, as well as trying to reduce a lot of the stress on the unit. You could also delegate you know, tasks that definitely that particular individual or that particular UAP is going to be performing competently and comfortable with. And you would only give them delegation tasks for stable patients, okay? You wouldn't give them to go check blood pressures on somebody who's maybe had a really labile blood pressure all day, and you've been giving medication to help either bring up the blood pressure or bring down the blood pressure. Those aren't a task that you're going to delegate because the patient is not stable. So the second question is, how will you maintain the safety of the other patients on your unit while 3 other nurses are occupied with a patient who is requiring resuscitation? This is where you could definitely implement functional nursing care, and you can instruct the team to focus on the most critical tasks that need to be completed, observing the patients, making sure they're safe, making sure that all the medications are given to the patients on time, and definitely completing treatments that need to be done right then and there. You could also temporarily assign the patients of the code participants to other team members until those nurses were free. Maybe the code's going on, the patient's still not stable, the patient's even not stable enough to even transfer to critical care. So we've got to get them at least stable before we get them out of this particular unit. So give their patients to somebody else until these nurses are free, maybe after the transfer to ICU or CCU or to MICU or SICU. So the last question here is, how might effective delegation to other team members contribute to the care of the patients on the unit? And I guess you could say that effective delegation would ensure that all patients are provided an appropriate level of care by an appropriate team member, okay? The nursing staff would be available to assist with patient care that has been reduced by the code. Therefore, I would ensure that the remaining RNs and the LPNs that are working in those units only do tasks that require their skills. All the other ones could be performed by the UAP. Okay, so these are things that might come up, and again, this might be a situation where you would have to definitely delegate, because if you've got these nurses tied up with this code, we've got to make sure that the other patients in the unit are being looked at and cared for. Okay, hopefully you can go over these little case studies and kind of, provide your own answers in regards to all the information that you've been provided in regards to delegation. Now I'm going to bring up some practice questions on managing care and about delegation. So let me bring that up for you in just a couple minutes. All right, up here on the screen I have some practice questions again. I think it really helps that we can kind of put together everything that we have talked about and what you have seen in the videos to kind of determine what the best answer is with these questions. Questions that are going to be very similar to the questions on your test, okay? So our exemplar is delegation from the concept of leadership. And these are about, after reading this exemplar, what you'll be able to do. I'm not going to go into that. I will put these up on the Canvas course so you can kind of go over those and review these and prepare for the test. So question 1, the new nurse is interviewing for a position on a med-surg unit. The nurse asks the manager what opportunities the nurse will have to develop skills, especially delegation. The manager tells the nurse that promoting delegation is a goal for the unit because... So think about what the answer would be. And hopefully you chose number 2. Because really it is about the patient. And with proper delegation, we will see patient satisfaction increase. And here's the rationale. I won't read that. You can go over this on your own. Question 2. An RN has been assigned to care for several clients on the shift. An admission experiencing pneumonia is to arrive from the emergency department. The nurse plans to delegate which of the following to the LPN, LVN regarding this patient. Now, look at everything carefully. What information do you need to be able to answer this correctly and answer with the best answer? So we've got a patient who's coming in that has pneumonia. So you might have a patient here that might have some respiratory issues going on. So look over the answers. The answer is performing a focused assessment. And And I think I would like to go over this rationale because the focus assessment, if you go back to Nursing 100, is performed in an ongoing manner during the shift or may involve focusing on a system such as respiratory, because this is where his disease process is mainly occurring, in the lungs, which only the LPN or the LVN can do. Only the RN can administer IV medication. The admission assessment cannot be delegated, and telephone orders are usually discouraged, but in this case the RN would take the order and the LPN could witness the order. So there's a difference between the admission assessment, which needs to be done by the RN, as opposed to the focused assessment. Question 3. A graduate nurse is caring for patients and does not want to delegate tasks to the LPN or the LVN because the nurse feels that the responsibility for care belongs to the RN. As a result, the new nurse may and the answer is lose the trust of coworkers, which makes sense. And this is a problem sometimes we see with new grads. They want to really appear to be confident and able to be handling now all the responsibilities of a professional nurse. And a lot of times it's hard for them in the beginning to start delegating, so they want to do everything for themselves. They want to do everything for the patient, and this is not always a good thing. First of all, they can burn themselves out, and second of all, it really doesn't start to create a good, trusting, and harmonious relationship with the people you work with. They might think, oh gosh, this nurse thinks she can do it all by herself. Fine, let her do it all by herself. I'm really competent enough. I could have done that for her, but she doesn't ask me anything to help her with. So these things, it really kind of gets the new grad on a bad foot with the people that she works for. But I'm telling you, it's very hard to delegate. Sometimes it's very hard to let go of some of these tasks. And, you want to make sure that those patients are being cared for and that the task is being, performed according to your specifications. So this is the rationale behind that. And then question 4, UAP has previously performed patient transfers, bed to chair, safely on many occasions. It would be inappropriate to delegate this unsupervised task to the UAP under which of the following conditions? And the answer to this is 3. Usually when it's the first time the patient is getting out of bed, it's really important that the nurse be there. Why? Because many times as the patient gets out of bed for the first time, they might have still some of the effects of anesthesia on board, might have a vasovagal, blood pressure may drop, and you really want the nurse there to know what to do in case these situations happen. So let's make sure the patient can tolerate it, make sure he's doing okay. So I'm going to be with the UAP the first time my patient gets out of bed. So that's why it's about safety. And those pretty much conclude the questions pertaining to delegation. So that is pretty much what we would have covered in class. On Monday we'll continue with our leadership concept, and we'll talk about the concept of communication in regards to interpersonal communication, looking at sympathy versus empathy, and then just discuss a little bit about the basic introduction to charting, especially when we talk about the term point of care charting. What exactly does that entail? And then we'll do a little exercise with that. So I think you've got a lot of great information now that you can view this in part 1 and part 2 of National Patient Safety Goals, the nursing process, and of course the exemplar of delegation. So if viewing this and listening to me over the weekend, if you have any questions, feel free to send me an email, or you can wait until we get together on Monday for our class. So have a great weekend, and again, thank you for your understanding of the fact that we couldn't have class the other day. I really appreciate that, and I look forward to seeing all of you on Monday, and have a wonderful and safe weekend. Take care.